Hi, everyone. Welcome to our HILS Health Infrastructures and Learning Systems online information session. My name is Angie Sullivan, and I am the program manager for the HILS online program. And it's great to see everyone on the call. And I'm going to turn it over to Dr. Karen Stahlberg.
Hello, everyone. As Angie said, I'm Karen Stahlberg, and I'm the director of the Health Infrastructures and Learning Systems online degree program here at the University of Michigan in sunny Ann Arbor. So I apologize if that sun comes across, but those of you who know about Michigan know that whenever we see sun, we love it. We'll go ahead and get started. We do have a little bit of a presentation to give you, and then we will absolutely open to questions. So hopefully you all can see the slides, and we'll get going. So in theory, there we go. One of the things that's really unique about HILS, or the Health Infrastructures and Learning Systems degree program, is that we're the first graduate program of its kind in the United States, because nowhere else can you get the joint emphasis on information sciences and social sciences combined to improve the health of individuals and populations. The goal is for us to develop people who are going to be leaders and professionals in learning health systems and implementation science. And we want you as a graduate to be someone who can create innovative solutions to really address the most complex and demanding healthcare challenges that we have. The nice thing about this degree program is the flexibility to complete it in 1 to 2 years, and the ability to complete it entirely online, which means that you don't have to necessarily move to Ann Arbor, especially since I gave you the clue that it's not always sunny here, but it often is sunny. But we do have a few in-person institutes where we ask you to come to Ann Arbor to participate in real time, and we'll talk about those in a few minutes. So the first thing to know is that the HILS program started actually as a PhD program. And so we have a number of international learners from around the globe, but the HILS online program is actually only open to residents or citizens of the United States. And that has to do with a lot of regulatory work that is really difficult to manage. But as you can see, now that we're a few years into the program, we have a lot of students from all over the United States as well. So the educational backgrounds of our students are varied. It can be folks who have expertise in computing or information sciences. Obviously, it sort of goes without saying that we have health sciences and healthcare professionals, but we also have folks who are engineers or behavioral scientists and social scientists, and those also interested in organizational and policy sciences and thinking about organizational change. So this is our current and inaugural cohort from the fall of 2021. We have a wide range of folks who are recent college graduates who plan on applying to medical school. We have someone who's a pharmacist and is using the implementation science focus and human factors focus of the degree to consider decision support structures within the electronic health record. We have someone who's a medical director and is thinking about building educational systems for clinicians. We have a senior level executive who's a CIO at a company. We also have someone who's a recent PharmD graduate who's looking at pharmacogenomics and data and how to augment clinical decision-making for treatment. And we have a U of M healthcare professional who's interested in learning health systems writ large in order to improve patient care outcomes. So I wanted to step back for a second and really talk about learning health systems and the process that learning systems go through to improve care. And so we talk about this learning cycle, or we talk about a loop, the learning loop, and it's comprised of a few components. So generally, this learning is centered around a health problem of interest, whether that's out of hospital cardiac arrest, opioid or drug use, it could be nutrition and exercise. It could be COVID, right? It could be maternal child health care. There's a variety of really complicated health problems of interest that people are looking at solving. And so this learning community comes together around this health problem of interest. And we cycle around the loop, thinking about the performance to data. So when people are providing care or when people are engaged around this health problem of interest, what happens? How do we understand this? How does this data get collected? And then how do we understand this data? And so that's taking the data and moving it into knowledge. So data analytics, how data is structured, how it's presented, how it's understood. And then once you have this data with evidence-based ideas and interventions, that's when the knowledge to performance piece comes in, or the implementation arm of saying, okay, we know that this change needs to be made. What's the best way to make it so that it's sustainable and that it makes sense? And so if you look at all of the things that happen around this learning loop, there's also infrastructure that needs to sort of be overlaid around this loop of activity. And so we need healthcare data for decision making. We need to think about policies and ethics for data use. Who owns the data? Where does it go? We need to figure out how do we share the knowledge so that everybody can improve and everyone has access to the data. The methods and processes for promoting behavioral change or incorporating these complex interventions into a system. And how do we set up technology to sort of drive and promote change? So we also think about all of the infrastructure that goes around the learning loop. And so the online degree program actually has courses that fit every component of that loop. And so it's a 27 credit hour degree program. And much like our Taubman Health Sciences Library is a very big building with classrooms, but no actual books. Our degree program is also online and in sort of this virtual space. As part of the degree program, we also want you to complete a learning cycle project. So that's application of the information that you're learning in the degree program. So the really important thing about this degree is that it's asynchronous, meaning that you don't have to be, in class every Tuesday from 3 to 5 p.m. The learning opportunities are released in a modular fashion week over week. And then there are synchronous options for class projects, mentoring, connecting with students. But all of the content is delivered through the Canvas Learning Management System, which is an online LMS that contains everything for the degree program. What's really nice is that you have the ability to review any challenging lectures. You have the opportunity to connect with your classmates. You don't actually have to be online at the same time to do so. And really the expectation, and these courses were designed so that you would spend about 8 to 10 hours per course, 8 to 10 hours per week per course. There are definitely courses that are heavier on reading or heavier on videos or heavier on computer programming and projects. And so really making sure that you consider how that fits into your current situation, whether you're taking this as a timeout from a current degree program or from a work effort, or if you're going to work part-time and take this degree, you want to consider those things. So this is literally what the degree looks like when you go into the online space. Everything is in the learning management system in Canvas, and it basically looks the same. We have introduction to the courses, and through course videos, there are recorded lectures. There are video overviews of the modules. Of course, we have reading assignments, discussions, quizzes, papers, essays. Basically, this is a master's degree program. It's just online. And so grading varies from course to course. This is an image of Ann Sales, who's one of the professors in learning health sciences, who's one of the founders of the degree program. And, she teaches implementation science. And so one of her courses is very heavy on reading and interactive sort of activities to help build your skills in implementation. Like I mentioned, we also want to help you apply the knowledge that you learn in this degree program by creating a learning cycle project. So in the fall term, when you first start, we have you meet with your advisor and sort of brainstorm around ideas. In the winter term, we help you refine your project proposal and prepare for the summer project. And then in that spring summer term, in addition to doing your learning cycle project, you'll also enroll in LHS 622, which is a capstone sort of learning cycle course to help guide you through your project and also learn about implementation and really bringing the projects to life. So this is an example from one of our PhD graduate students, actually, Rama Winesi, who is actually going to be defending for his PhD very soon. But what he did for his learning cycle project, he currently works in the operating rooms at Michigan Medicine. And what he wanted to understand is surgical counts and sort of the discrepancies between sort of instruments being left sort of in the surgical field and reporting. And really, technically, there should never be an event where, you know, a surgical instrument was left behind. But for whatever reason, it does happen. And so he's trying, with this project, he was trying to understand what are the barriers to reporting? Why don't people report, right? And so what he understood, and by doing some research and presenting it in this data, he's basically found that there are sort of 4 common barriers. People have time pressures, they don't have feedback about reporting, they're really uncertain about what the policy means. You know, if you leave it and then you go back and you find it, but there was no harm to the patient, does that count, kind of thing? And then also the reporting structure format is not user-friendly. And so there may be reasons why people underreport incorrect surgical counts. So one of our graduates from the program really talked about the utility of the Learning Cycle project because it, again, connects that core curriculum to real world practice about how learning health systems work, how can projects be improved, how can you make substantive change around a certain health problem of interest. So a quick overview of the course sequence. This is a listing, just a high level view of how things would look if you took the degree program in 1 year. So at Michigan, we are divided into fall, winter, and then a spring, summer semester. And so the fall courses, you would have 4 3-credit courses, and winter, same, so that's 12 credit hours. If you do the math, that's about 120 hours a week, perhaps, of work. So again, that's why it's important to consider what other things are happening in your life, whether or not you go full time. We do have some on-campus time, one time in the fall for orientation, time in the winter, and then time again in the spring, summer. And the goals really are to get that project started, participate in weekly project calls, and complete your project. If you were to move things out to 2 years, then we recommend taking 2 classes or 6 credit hours per semester. So that would get you, it's technically a 2-year plan, but it ends up being something like 18 months. The courses are definitely offered in specific time slots. And so while they're not necessarily attached to one another, like 621 is only offered in the fall. And so thinking about the cadence of how you roll out the courses is really important. So here's a picture. The individual in the center is Gretchen Pyatt, who actually is the graduate chair for HILS. Rama is to her right. And what we wanted to do is just give you a quick overview of the Learning Health Systems courses. So when we think about health infrastructures and policies, we have 2 courses, 650 and 671, particularly around ethics and how healthcare data is structured. We have 2 courses on implementation science. 621 is that intro course. 622 that I teach is an application course, really thinking about what does this mean and how do I take it forward. This image is of Dr. Chuck Friedman, who's the chair of the department and really one of the sort of world's leading experts in learning health sciences. So we show you these real world pictures that you kind of recognize that, like, there's real people behind the courses, and the courses are taught by our faculty here at Michigan. So we have some data science courses and research methods, as you would expect. And these are some of our initial cohort students. So Grace there in the center said that she chose HILS because it's the future of medicine. She's going to apply what she learns daily in her role as a doctor of pharmacy, and thinking about pharmacogenomics and decision support for medication. What you see here is an image from our on-campus institute where we bring everyone from HILS together. So HILS master's students who are online, HILS master's students who are residential, HILS PhD students who are residential, and the faculty. At least in orientation, what we do is get to know one another, learn about the program, and then we break into groups so that we can talk more specifically about what HILS Online is about, and the PhD folks can get their information as well. The reason to bring people on campus for institutes is really to reinforce your current coursework, as well as to provide networking and mentoring opportunities. Those institutes are generally 2 to 3 days on campus, where again, we do active learning sessions, we do skill development, one-on-one mentoring, and then we really like to do socialization. So we have parties, we have gatherings, we have opportunities to meet and greet and connect. So we're hoping that you too think that this is a great opportunity to lead and change and transform health, to get new skills or expand existing skills to really improve quality and safety and promote learning health systems. And we think about our Master of Science graduates as improvement and implementation leaders in this evolving system of learning health systems. In terms of careers, what's really nice is things are sort of wide open, right? Because learning health systems and the concept of instantiating learning health systems is really new, there are lots of places and spaces where people need to scale up or to expand their current understandings and capabilities, to be health science innovators, quality improvement experts, to be folks who can take the healthcare data and really apply data science to it and create a learning from it that can be applied and analyzed in real-time care. So folks ask us, where are your graduates? Well, in terms of the HILS Online program, I will say that we will be graduating our first class in August. One of them is well, he's how can I say this the right way? He like runs the show. And she's going to help me out on this one in a minute. But he actually is involved in a company that supports electronic health records for a very large group of providers over a number of states. And so what he's thinking about is educating all of those providers around learning health systems and creating this community of learning that can happen throughout the entire organization. We have clinical research coordinators. We talked about data analysts, data managers. And then I would warn you to be careful, because there are a number of folks who did the master's program who then decided, you know what, I actually want to get a PhD in HILS, and they stayed on with us for that. So I'm going to hand this over now to Angie to talk about some things that are really student focused, since she is really the biggest support for our learners in terms of the nuts and bolts of the program. Angie?
All right, thank you, Dr. Stahlberg. So I am going to cover some of the student services side of things, as Dr. Stahlberg was saying. So to begin with, advising. So students are paired with a faculty advisor who will have live office hours, and typically these are going to be via Zoom, or you can contact them via email. And Dr. Stahlberg mentioned too that you're going to be taught and mentored by the same faculty who teach in the residential program. So for example, here is picture Dr. Rachel Richardson. She was at our HILS online orientation session in August. And she's a professor in our department, and she conducts research on the quality and usability of data from electronic health records. And here she is advising one of our new HILS online learners who has an interest in learning health systems to improve patient outcomes. And you'll also have easy access to me as a program manager through email, through individual group, Zoom meetings, Slack, HILS online community page, and Canvas. So there are a variety of ways for you to get in contact with me and Dr. Stahlberg. And the one thing that I did want to point out is that even though this is an online program, you will be supported by real people such as myself, Dr. Stahlberg, and other faculty, as we truly want to give you the full learning experience as a Michigan student and ensure that you become part of the community. So being a student in our online program, you'll have access to an abundant variety of student support services, as you'll see here. So you have the Rackham Graduate School, which has student communities such as students with children, students with disabilities, LGBTQ+ students, health and well-being resources. There's the Office of Graduate and Postdoctoral Studies, and this overlaps somewhat with what Rackham offers for resources such as health and wellness, diversity, equity, and inclusion resources. And you'll also have access to other university resources such as counseling and psychological services, Taubman Health Sciences Library, in addition to all other libraries on campus. Students of color of Rackham is listed here. There's just a variety of student support resources for our online students. Tuition, this information is based on the 2021-2022 academic year. So please note that tuition and fees often change each year. So again, these are based on just this year. So typically a student's going to take between 6 to 12 hours, 6 hours being part-time, 9 hours or more is considered full-time. So for example, if you're a part-time Michigan resident, tuition is $7,301. And if you're a non-resident taking 6 hours, which is part-time, it's $10,331. For full-time, 9 hours, tuition is $10,859 for Michigan residents. It's $15,404 for a non-resident. Then for each additional hour after that, it's $1,186 for a Michigan resident and $1,691 per credit hour for a non-resident. And there are also mandatory fees assessed each term, as you'll see here. Registration fee, central government fee are a couple of those, and those total around $164. We wanted to break it down for you even further. So if you were to complete the program in 1 year, this is what it would look like. As a Michigan resident for that fall semester, it's $14,417. That second semester winter term is $14,417. And then spring summer term is $3,743. This will give you an estimated total of $32,577. And as a non-Michigan resident, that first semester is $20,477. Again, the next semester is $20,477. And then that spring summer term is $5,258, giving you an estimated total of $46,212. So again, this is based on 2021-2022 data and is subject to change. Some additional expenses, technology needs you'll want to consider: study materials, usual things like books, notebooks. And the one thing to note is that many of our textbooks are online and they're free, or the resources that faculty use in their courses are often free. You'll need high internet service, computer equipment and software. This is what's recommended university-wide: is a webcam, RAM of 4 gigabytes, microphone, headphones, compatible browser. And then additional expenses will be for travel expenses, like Dr. Stahlberg mentioned. Students will be required to attend the in-person institute sessions on campus. Application requirements: we require a bachelor's degree with 1 statistics class, a personal and academic statement of purpose, a resume or CV, transcripts, 3 letters of recommendation. And for these letters, you'll want to choose people who know you well and those that can provide an evaluation of your ability to perform and succeed at the graduate level. And often that might include a manager or supervisor from school or work. And at least 1 letter should be submitted from a past or a current professor or academic advisor or someone with an advanced degree who has supervised you in a job or an internship. And please note that we no longer require the GRE. So now I'll review some tips for your statements, starting with the academic statement. So this is where you will want to discuss your primary research areas of interest. You'll want to reach out to potential advisors, 2 to 3 HILS faculty, to introduce yourself and discuss the potential fit to our program. And you'll want to do this before completing your academic statement of purpose. And you can read about each of our faculty on our website and choose those that perhaps are doing research or teach in an area of interest to you. And in this statement, you'll want to explain why you identified the potential advisors you did and interactions you had with them. In addition, you will want to describe your understanding of learning health systems and what interests you about them. Describe any prior research experiences, courses, or projects that have prepared you for a graduate study. And all of this is covered on the actual application, so you don't need to remember it right now. And then for your personal statement, this is different than your academic, and this is where you get the opportunity to explain how your background and life experiences, other opportunities or challenges motivated your decision to pursue a graduate degree at the University of Michigan. So this should be more of a discussion of your journey that has led you to your decision to seek a graduate degree. And you just want to make sure that you do not repeat your academic statement of purpose here. And we have some resources on learning health systems that can help you with your applications that I'll send to you in an email after this session, in addition to the other information that we discussed today. So to begin with, we have a couple of journal articles. The first one, Development of the Learning Health System Research Core Competencies. This discusses how the core competencies for learning health systems were developed. Next is a journal article written by the chair of the department, Dr. Chuck Friedman, who you saw earlier, and Josh Rubin, who is a program manager in our department, with weaving together a healthcare improvement tapestry. Learning health system brings together health IT data stakeholders to share knowledge and improve health. So be sure to check that one out. And in addition, a website link to the Learning Health Systems Open Access Journal, which is an open access journal that is freely available to read and download. And last is the Agency for Healthcare Research and Quality Learning Health Systems website, AHRQ. And this is an agency that funds LHS researchers. And you can go here to learn about different types of research that is funded by the agency. So again, I'll be sending you all of these resources. Some tips for your application: be sure to proofread it carefully. Ask a friend, a colleague, a mentor to review it, just paying special attention to those typographical errors, grammar, punctuation, and overall clarity. So how to apply? So since we are a Rackham program, you will apply through the Rackham Graduate School website. You'll complete their online application, and on the site you can upload materials in addition to sending them to us if you need to. And we have 2 deadlines. First is February 1, which is already passed, and all applicants who applied by that deadline were eligible for priority scholarships. So then that next deadline is coming up, which is June 1st, and that is the final deadline to apply. So the application timeline, we aim to notify applicants 6 to 8 weeks after the receipt of the application. So please get them as soon as you can. And for transfer credits, at this time, we're not allowing credits to be transferred. However, if you've taken a course that is equivalent to a required course for the program, we may be able to review options for substitute electives or other course options. And here's our contact information along with our website. You can find a lot of information on our website. In addition, feel free to reach out to Dr. Stahlberg or myself at any time with questions. So at this time, we would like to thank everyone for attending and open it up for questions.
And I'm going to stop sharing. There we go. So please feel free to unmute and or turn on your camera. Happy to answer any clarifying questions or just, talk about life in Ann Arbor. I mean, look at the sun. It's amazing right now. It's just like, I want to get out there.
Yes. We have a question in a chat, it looks like. Oh, that's just to me directly. And I can get back to you on that if you would like, Parvin.
Hi.
I had a question on the part-time program. In the slide, it said 2 to 3 years, but then it broke down to more like 18 months. Is the 18 months kind of as long as it can be stretched out, or are there options to stretch it out a bit longer if needed?
Yeah, I would say our goal is to figure out what works best for people. And so we're not trying to rush people through. On the flip side, right, I wouldn't want someone to take 4 years, because remember, the longer you take, actually the tuition goes up every year. And so, you know, we're not meant to be a degree factory here, really. Like, the interest really is in admitting and graduating people who are going to, you know, be difference makers in healthcare. So.
I actually have one more question. I'm actually a veterinarian. So
Perfect.
as that, I guess I answered my question. It doesn't have to be strictly human health. Is that you're open to any health people? Okay.
Yeah. So, okay, here's a really interesting question for you. What type of, like, you know, burning platform issues might there be in veterinary health?
Well, I work for a large corporation of about 1,100 hospitals, and I run their mentorship program. And I've continually been like, how do I improve the learning? How do I improve the system? How do I know if they're learning what they need to know? So I've really tried to explore a lot of options, and I feel like your program really sort of nailed it on the head to just, how do you gather appropriate data? How do you process it and understand it correctly? But then what I really like is, how do you then apply it? Because my job is very applicable. I mean, every year I have a whole new set of kids that we're working with. So I'd love to do that. And then of course my job kind of delves into, you know, some patient safety, quality medicine, all of those kind of issues sort of tangentially.
Yeah.
So I just see a lot of applications for, you know, how do we continually improve the learning and within the hospital, you know, the flow of patients and things like that. So.
Yeah, no, absolutely. And I would say, you know, those learning loops can be applied at a variety of levels, right? It could be, how do we teach individuals? How do individuals learn? It can be, how do healthcare organizations, how do hospital systems, right? It just, nation states, like, it just depends on what your level of scale is. And so, you know, we definitely consider, you know, again, it's really about, like, so if people want to get like a health informatics degree, right? That's only one component of our degree program, right? If somebody wants to do a public health degree, that's like one component of our, right? But this really kind of gives you the whole package of what's data, what's healthcare data, how do people learn, how do we implement change? You know, gosh, we even teach you how to do R. So, yeah.
Yeah, no, I love it, because I think for me, working in private practice, it's all about the practical and how do we actually make this happen in the hospital with a real person and real issues in the hospital. You know, your nurse called in sick, like, how are you, you know, like, it's having worked in both academia and private practice, I'm like, yeah, it's more trench work. Like, it's the real world. And so I love that you guys incorporate implementation with it so that you can really make change, because I like both.
Yeah, excellent. Yeah, no, that's great. Yeah, that's the thing is, you know, the learners are very diverse, and the skill sets that people bring are also unique. I think that if someone did not have sort of a background understanding necessarily of healthcare or healthcare systems, it might be a harder reach. But if somebody has already has experience of what it means to be in a healthcare environment, whether that's mammals or reptiles, I think it's okay.
Yeah. Our patients have a little more fur. We use
Yeah.
a lot more lint rollers than you guys probably do.
Yeah. Well, it's going to sound funny, but in some ways you've got two sets of patients, right? It's the
Yes.
patient and the parents of the patient. So
Yes, we often say if we were like any human equivalent, it'd be pediatrics.
Yep.
Because yeah, they can't talk. They can't really tell you. They don't really have control over what they're not doing or doing. It's it's very similar.
Yeah. No, it's awesome. I have a 95-pound Bernese Mountain Dog. Who's
Oh,
a good boy. Yes.
oh, lovely.
He's a
I
sweet
know.
Yeah.
Whenever we have our Zoom call, like, obviously there's lots of Zoom calls across, meetings and all that. There's always some pet wandering through all of them.
Yes. Definitely.
It's really nice.
Definitely.
Okay.
I want to make sure, any other question? Ibtisam, I saw that your comment in chat, and I'm thinking that Angie can help you with that.
Yes.
Offline,
Yeah, I can definitely help you offline. And I believe that we've been in contact. It could take a couple of days. I don't know how long it's been, but if you continue to have issues, just reach out to me. I would give it another day maybe, and then we can look into that and see what's going on.
Yeah. Other questions? So I have to ask to my veterinarian colleague, you're listed as Dominic. Is that a correct moniker?
Excuse me, I just swallowed something and it went down the road. Yes, it is Dominic. Yeah.
Wonderful.
My parents love the name, so they said, whatever gender comes out, you're a Dominic. So
That's fantastic.
it's definitely caused quite a few hilarious moments. Like back in the Stone Ages when I went to undergrad, they just put names up on your room. So you didn't know who your roommate was. You just walked around until you found your name, and that's where it was. And my roommate got there before me, and she went to the RA and said, I think you put me in the wrong room. I'm with a boy. I'm like, no, you're good.
You're good.
So, yeah.
Well, as Karen with a C, I can appreciate,
Yes.
name
Yeah.
confusion. Yeah,
Yes.
that's great.
Wonderful. Well, thank you for doing this. This was really helpful to kind of bring it, sort of all tie it together. And yeah, I've been stalking your website, so it's nice to
Excellent.
to have it laid out.
Oh, good. Well, obviously, if you have any questions, just reach out directly.
Okay.
This is shameless, but at Michigan Medicine, we actually have a very robust veterinary medicine
Yes.
program and residency program. And so if we needed to, we could, help connect you with folks there so that there was some relevance and applicable, right? So that you weren't trying to explain what it means to be a DVM and also capture data. So
yeah, no, that would be great. And I think, data wise, the company I work for is part of an even bigger company. Oh, sorry.
It's all good.
Small child. And so, sources of data, luckily its scale would be quite easy, which is good.
Oh, good.
Yeah, I'm on a call.
Mama, can I take a bath because of that?
Yes, you may. Okay.
But I don't know how to turn on the hot water.
Okay, I will. Oh, almost.
That's good.
Sorry.
We're very glad that you don't know how to turn on the hot water.
Bath in the downstairs bathroom, okay?
Okay. She's why I'll be waiting a year to apply because I need to get her into school. Yes. Anyway, thank you very much.
Absolutely. Thank you for your engagement. Anyone else with questions? See, this is that teacher skill you get where you learn to just sit in silence for a few minutes in case somebody wants to answer. But we also want to be respectful of your time. And so we're happy to sort of close this out. And if you have any additional questions or concerns, just reach out to either Angie or myself or any of the other faculty. You know, we're happy to answer questions. Angie, anything else you wanted to make sure we said?
Nope, just thank everyone for coming, and I will be sending you all those resources that I mentioned in addition to recording and the PowerPoint presentation.
Wonderful. All right. Well, everybody have a great day. I hope it's sunny where you are and you can get outside.
Bye.